Hi, Katie.
Hi.
It's very nice to meet you again. My name is Dr. Matt. I'm going to do your exam.
Great.
So, before we begin, I'm going to take your medical history. And then I will ask you a few more questions to see exactly what your goal is for today. After that, we'll start the exam.
Okay, sounds good.
Can you please verify your first and last name and your date of birth?
Katie ASMR, March 23rd, 1988.
Do you have any allergies?
No.
Okay, when was your last checkup?
It was a year ago, so it's been a while.
Do you take any medications?
No, not currently.
Any surgeries?
No.
Do you have any medical history?
I took antidepressants for a while. I had a bunionectomy 10 years ago. Let's say in the hospital with pneumonia when I was a child.
Okay. And how many hours per night do you usually sleep?
6 to 8, depending.
Okay. Do you follow a special diet?
No.
Are you experiencing any pain right now?
No, not really.
Okay. Do you have any difficulty breathing sometimes? Feel any palpitations?
No, not really. I do have abdominal bloating sometimes.
Okay. And have you noticed that it comes and goes, or is that all the time?
It's been pretty constant lately.
And you said you have no allergy, so you don't know if you're allergic to any foods yet, right? Or if you're sensitive.
I did take an allergy test a while ago, and it said I was allergic to every food on the list, so I think it might have been
That you were allergic?
yeah, but I think it probably was a faulty test because
Okay.
I eat all the foods on the list, so.
Okay. So maybe we can repeat one of those tests that we have in the office.
Okay.
All right. Do you suffer from frequent headaches?
No.
Okay. All right, I'm gonna go ahead and take your vital signs.
Okay.
So this will go on your index finger. We're going to measure your oxygenation and heart rate reading your books. And then I will take your temperature. 98.3. Okay. Oxygenation is 95% on the room air. And heart rate seems stable in the 70s, which is perfectly normal. Let's go ahead and take your blood pressure. Okay, go ahead and relax your arm. And uncross your legs for me, please. Perfect. And I'll have you relax, breathing normal. Blood pressure is normal, 110/65.
It's good.
I'm going to listen to your heart and lungs.
Okay.
I'm gonna have you breathe normal as well. I can hear only S1 and S2, now S3, now S4. Let's take a listen with the bell in here for any murmurs. Can you take a deep breath in and hold it for 3 seconds? Breathe in, hold it in, and breathe out. Let's do one more time. Breathe in and hold it for 1, 2, 3. Breathe out. Okay, very good. Now take a deep breath in and exhale. Down, take a deep breath in and exhale. One more time. Breathe in, exhale. All right, I'm gonna have you turn around so I can listen to your back, okay?
Okay.
Take a deep breath in and exhale. One more time. Breathe in and breathe out. Very good. Breathe in and breathe out. Breathe in, breathe out. And again, exhale. Inhale, exhale. Good. One more time. Okay. I'm gonna have you stay there. So we're going to tap. We're looking for any fluid buildup or signs of pneumonia. Have you been experiencing any recent cough?
Yes, actually.
Okay. Alright, so everything looks good. Now I'm gonna have you turn around. We'll do a few more tests before I have you lay down and relax on the table, okay?
Okay, sounds good.
Alright, I'm going to put gloves on. Since you mentioned that you're having a little bit of cough, I want to take a look inside your throat and see if there is any infection or signs of inflammation.
Okay.
Okay, go ahead and give me a big I'm noticing a little bit of redness on both sides. Uvula is midline. Tongue is pink, well moistured, and symmetric. Go ahead and try to push with your tongue inside your cheek. Good. And on the other side. Excellent. Can you give me a big smile? And frown with your eyebrows. Good. Can you puff your cheeks for me? Keep them puffed. Don't let me unpuff them. So let's do that one more time. Don't let me puff them. Okay, perfect. And can you move your tongue up and down, side to side? Perfect. So that was good synchronization there. Just going to check the patency of your nose now. And just going to slowly palpate to see if there is any signs of deviated septum or anything like that. Okay. Can you go ahead and breathe in, breathe out? One more time. All right, perfect. Going to go ahead and check your sense of smell first. I'm going to have you close your eyes and just slowly and normally breathe in through your nose, okay? What does that smell like?
Smells like cedar.
So let's go ahead and try one more. Close your eyes. That usually heightens the sense of smell. Breathe in, slowly concentrate on the smell that your brain is percepting. And what does that smell like to you?
Vanilla.
Alright. And we're going to go ahead and check your taste as well. So the same thing we're going to do now. I'm going to have you close your eyes so that we allow your brain to focus only on the taste. Perfect. Go ahead and tell me what that tastes like.
Tastes bitter.
Bitter?
Mm-hmm.
Okay. Let's try this one now.
Sweet.
Sweet. Perfect. Okay, so I'm going to check your pupils now. Go ahead and look straight at my nose. Good. Keep on looking straight at my nose. Perfect. I'm going to lower your eyelid. Take a look and see if there is any yellowish discoloration. Good. Good. And now go ahead and look right here. I'm not noticing any rhythmic movements. Now look here. Okay, very good. Go ahead and follow my finger with your eyes only. Don't move your head. Okay, very good. Go ahead and cover one eye now. And I have here a Snellen chart. Go ahead and grasp the Snellen chart with your other hand and extend your arm all the way. Perfect. How does that look for you?
Pretty clear. Yeah.
Okay. Go ahead and read this last row, starting with the first letter to the left.
HPFTL.
Okay. And what color do you see here?
Green,
And here.
red, orange.
And what number do you see here?
8.
What about here?
2.
Which circle is smaller, 2 or 3?
2.
Okay. Let's go ahead and switch eyes now.
Okay. Go.
Okay. Extend your arm all the way. Perfect. And go ahead and read this row, starting with the first letter to the left.
LTFPH.
And what color do you see here?
Green,
And here.
red.
What number do you see here?
8.
And here.
6.
And which circle is larger, 6 or 7?
7.
Okay, perfect. All right. So now what I'm going to have you do is I'll have you laid down and I'll give you a count to change. We'll do a back and abdominal assessment and we'll see how everything looks, okay?
Sounds good.
I'm going to first palpate your scalp. Let me know if you feel any kind of pain. Okay. Head is symmetric. I'm not feeling any lumps. Normocephalic. Okay, perfect. I'm going to take a look at the scalp to see if there is any infection. I'm not noticing any redness. I'm going to do a few tests. First, I'm going to lower the acidity of the scalp. That will help to assess if there is any infection of the follicle. I'm going to apply a drop of the solution at the base of the follicle. And we're going to make sure that we distribute it evenly. Now go ahead and tell me if you feel this on the left or right.
Right. Right. Left. 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 Right. Left.
Go ahead and tell me if you feel this soft or sharp.
Sharp. Sharp. Soft. Sharp. Sharp.
Scalp looks in very good health. Not noticing any vesicles, papules, raised bumps. There's no redness, no sun damage. Okay, now go ahead and tell me if you feel this on the left or right of the hair part.
Left. Right. Left. Right. Right. Left. 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 Right. Okay. In the middle.
Oh, perfect. Everything looks very good. Now I'm going to go ahead and check your abdomen. Okay, Katie, go ahead and make yourself comfortable. If you experience any kind of pain, let me know. So first, just going to visually inspect for any redness, any swelling, asymmetry, which could indicate a little bit of inflammation. So I'm going to go ahead and just Listen with the bell first. It's gonna feel a little bit cold. Noticing a little bit of decreased sounds around the middle, very close to the umbilicus. And then besides a little bit of bloating, are you experiencing any other symptoms?
Not really.
So I want to make sure that I'm listening on all four quadrants. impression exam is normal. I'm going to go ahead and slowly palpate. Okay. Seems to me that there is a little bit of inflammation around the belly button, the umbilicus area. So I want to take some measurements. That way we know for sure how much asymmetry we have. About 4 to 5% difference. Okay. Looking for any pulsations or changes in skin. Go ahead and tell me if you feel this on the left or right.
Left. Right. Center. shoulder. Both. Left. Right. Right. Left. Left. Right. Right.
Okay, very good. The treatment that I'm recommending, it's an anti-inflammatory ointment. And it's going to be applied 3 times a day.
Okay.
Around the central region of the umbilicus. Okay. Slowly I'm going to distribute it. Okay, I'm going to go ahead and check your legs and reflexes. I'm going to go ahead and just lift the blanket. Okay, I'm going to check pedal pulses. Make sure that they are both strong and synchronizing. Very good. I'm going to check for any edema. Good. Temperature on both feet seems to be about the same. Can you go ahead and wiggle your toes for me? Very good. Now go ahead and try to pull your toes towards you, and I'm going to push in the opposite direction. Go ahead, pull, pull, pull. What about the right one? Seems to be a tiny bit weaker. Okay, good. Relax. Now go ahead and push with the pads. Relax. And try to wrap your toes around my fingers. Good. I'm going to move your toe either towards you or towards me. Go ahead and tell me which way it's going, okay?
Okay. Towards me. Away. Towards me. away.
Okay, very good. Do you feel this on the left or right?
Left, right, left, right.
Okay, I'm going to check your Babinski reflex. Go ahead and relax. Perfect. Okay, I don't hear any abnormal sounds on the left. Okay, very good. Now let's go ahead and check your spine alignment. Okay, I'm going to start with measurements. No deviation of the spine. Not noticing any scoliosis or lordosis. I would say that your back is very symmetric, so I have no concerns about the alignment of the spine. I'm going to check the skin though. Since you do have a few moles, we want to make sure that they look good and that they're healthy. So now I'm just checking a few of the moles to see if we notice any changes after we apply a solution. And mostly I'm focusing on the ones that have a little bit of an abnormal shape or just seem to be slightly larger. Go ahead and take a deep breath in and exhale. And again, breathe in, breathe out. Breathe in, breathe out. And again. I'm not noticing any signs of pneumonia. I'm going to have you stand up and we're going to discuss the results and see what recommendations we have for you today. Alright. Everything looks very healthy.
Good.
Next, I'm going to send you to the Women's Health Department, and that's where we're going to do a gynecology exam and a pap smear since it's been about 3 years since you've had one.
Okay.
And then we're also going to do some blood work. Is that okay?
Yes, yes.
Okay. Okay, no medicine for today that I need to prescribe. Do you have any questions for me?
Not right now. Thanks.
Okay, wonderful. Thank you, Katie, for coming in.
Yes.
And I'll see you soon.
All right.